And what evidence is there that current early intervention and family support measures are effectively reducing placement breakdowns and improving reunification outcomes, please?
Yeah. So I think the first thing, and the Chair would have referenced it in her opening address, one of our absolute strategic priorities for Tusla is to expand and grow and promote the work we do in early intervention and support. And we do that because we know that the outcomes are better. We know that when children receive early intervention, when they receive that early family support, that we then can mitigate those families that may reach a point of crisis where those children may have to be taken into care. And that early support, I think it's important to say, crosses across not just Tusla, because very often it's the birth parents may need that support, either in terms of, adult mental health services or addiction services. And so if we look this year, we've now increased our funding. We're funding 136 family resource centres right across the country. As part of our reform programme, we're setting up currently 90 new early intervention and family support teams. So that means across our 30 areas, there'll be 3 family support and early intervention teams in place. And we're doing that because we know that when we look at our 106,000 referrals last year, at least 60% of those were looking for a family support and an early intervention. That's what they needed rather than child protection. And so for the first time now, new dedicated family support and early intervention teams right across the country who will be able to provide more timely access to services. We're also obviously funding over 450 community and voluntary sector agencies right across the country, a really core part of how we deliver our services. And obviously then we do support where there's a risk of breakdown in terms of family support or in terms of foster care services or residential services. It's putting supports around those young people to try and prevent that placement from breaking down. But certainly a huge part of our work.
Could I just add to that, because you're looking for hard evidence. So obviously to get hard evidence of to what extent an intervention is creating an effect means controlling a lot of variables. And, as you know, in the social area, it's not really ethical to be setting up control and experimental groups in that way. What we are noticing, though, since the reform programme data has come through, is that in areas where, for example, there's more investment in family support, there's less reliance on residential care. So we're now, correlation doesn't prove the cause, but we are now thinking, okay, our impressionistic sense that early intervention can divert people away from residential care it works, but actually to do the causal connection is quite extensive and expensive piece of work to do. But I think it's safe to say that the impression is probably true. Also, to add that, in some countries, we tend to look at residential care as, the final option, when things are really completely broken down. Not all countries look at residential care for children in that way. Some countries see it as part of a continuum of support where perhaps, children come in, provide a family with respite while, gathering their strengths and their capacity being built, etc. So it's not necessarily the end of the line, if you like, but there's definitely an interplay. But the hard evidence is more difficult to categorically state. It's more interesting correlation at this point, I think, to be fair.
Thank you for watching. Please like and share.